All right, I would like to welcome everyone to the first MTGA educational webinar of 2025. We are joined with Dr. Holmen to talk a little bit about rural healthcare. We are joined with NTF Dale Nellor to give us an update on the federal political side of things. And then we will close out with Dr. Shauna Voss for a Minnesota Board of Animal Health update. If you have any questions, please put them into the question and answer box, and we will address them as they come in. This webinar is being recorded, and it will be uploaded to our website if you would like to review it in the future. And I'm going to jump off and turn it over to Dr. Holmen.
Thank you very much, and good afternoon, everyone. It's good to be with you. I'm Ken Holmen. The Holmen family is from Comfrey, Minnesota. I'm sure most of you know where that is, farm family. I actually grew up in Forest City, Iowa, and went to medical school at the University of Minnesota. And I've been at CentraCare for about 10 and a half years now. CentraCare is a not-for-profit health system based in St. Cloud. We have 10 hospitals in our system, all the way from Redwood Falls all the way up to Long Prairie. So we're mostly in western, south central, and just slightly northwestern Minnesota. We have about 13,000 employees and serve roughly 750,000 Minnesotans. And our organization recognizes that we have an accountability, and not only for healthcare, but to have our communities thrive economically and have a bright and vibrant future. My comments today are going to be about rural healthcare. Our board has adopted a phrase called making rural life healthier, because indeed that's something that unites all of us. And so as I go through my comments, I was debating whether to have a PowerPoint, and I'll be 73 here in a couple of months, so I'm not really a PowerPoint kind of a guy. So I thought I would just chat for 15, 20 minutes and then take questions. And so my comments are going to talk about the challenges of making rural life healthier, and then specifically perhaps what CentraCare is doing to address that. So the major challenge we face in rural America is a demographic challenge. And I'm sure that all of you have noticed that in your communities and even in your industry. We have an aging America. Last year, first time in American history, we have more people over the age of 65 than under 18. And so the challenge for that is that it's more pronounced in rural areas. And it means that there are fewer workers. Younger folks are folks that provide healthcare and provide work in our farms and our factories. And additionally, the health needs of an aging America are more complex and more common. So in some respects, it's a double whammy. And the birth rate in America continues to be low. The birth rate in America last year was the lowest it's been in history. It's 1.7. 2.0 is kind of replacement. And so we face a future where we have to recognize that there is an aging, shrinking workforce, which means there's fewer tax revenue, fewer workers, and the demand for healthcare services is higher than ever. The average farm has gotten bigger and bigger, and the number of folks that live on a farm has gotten smaller and smaller. Additionally, most of the educational opportunities for kids are in large metropolitan areas. So if you understand that demographic challenge, our initiatives are around workforce. I'm certain that you have noticed, as I mentioned before, the significant challenge in getting young folks to enter into a field. So we're spending a lot of time on recruitment and retention. How do we adjust our needs to attract the younger folks to come and live and work in our communities and participate in the work that we do? We are spending more and more time, money, and energy on training. How do we have roughly 1,000 students a year in CentraCare in all sorts of areas. And most importantly, how do we actively get engaged in education? We most recently have started a medical school. So we'll have our first students this fall. It's with the University of Minnesota. We'll have 24 students a year for 4 years to create medical students who will become physicians. We know that folks that train in rural environments are a lot more likely, very likely, in fact, to stay in rural communities to practice healthcare. And so not only are we starting a medical school, but we have now two family practice residencies, one in St. Cloud and the other in Wilmer. We have started a laboratory program. We have two imaging programs for imaging technicians, one in Wilmer and one in St. Cloud, and a whole host of other educational activities as we partner with our public schools, even high schools, as well as our state colleges and private colleges. And so educating our workforce for tomorrow is a recognition that we can't complain about a problem. We have to do something about it. So we're investing heavily in our workforce and creating opportunities and in fact recruiting kids to come back to rural environments for an education. The second challenge we face is how do we get access to folks? As you know, we live in a kind of a bifurcated world nowadays that's both high tech and high touch. I'm sure all of you buy stuff online. Last year in America, more people bought stuff online than they did from a physical store. That has remarkable implications to the way we do our business. It has remarkable implications to the way that we provide healthcare. Much of healthcare can be done with a high-tech solution, video, audio, on demand. But if you are sick, you want to see somebody. You want to trust someone. So we are working on this paradigm shift where it all was done in person to where we offer multiple modalities to provide healthcare, whether it's asynchronous, online, iPad, virtual, in person, and in fact, a great deal of outreach as well to smaller communities. So how do we understand the need that to provide care in a rapidly changing environment using multiple modalities? The primary challenge to that is both technology and people. Let's talk about technology. CentraCare worked with several institutions to get some more funding for Minnesota for broadband. Much of our rural area has poor broadband coverage. And if we're expecting to have a technological hookup for a wellness visit that's online, you have to have fast internet speeds. So technology challenges are very real. And the second is a people perspective. We're in this generational divide where young kids, I'm sure your kids and grandkids are, they they type with two fingers on their phones. I'm a plucker. I'm old enough to be a plucker on a keypad. But our older patients are not tech savvy or even like it. And so we have to recognize that we have to provide services to patients where they're at and in a way that provides the care that they think they need and deserve. So we're trying to manage this bimodal fact of in-person, high touch, and technology-driven high-tech services. You're well aware of the impact of artificial intelligence. We have 6 AI platforms that run in the background of much of our systems. We have an electronic health record called Epic that not only is in our 10 hospitals, but another 14 facilities in outstate Minnesota to, again, help coordinate care. So access, technology are really important things for the future. The next challenge is improving quality. Healthcare outcomes for rural Minnesotans are not what they should be. And there's multifactorial. And rather than address the factors per se, I want to focus instead on what we are doing. So one thing is education. How do we have folks understand what they can do to improve their lifestyle and their healthcare outcomes? Number two, how do we give access to healthcare so that folks can get the care and the information when they need it, whether it's virtual or in person? Third is once they enter our care system, how do we make sure that we are doing our best? Several of our programs are nationally ranked. We have the largest stroke program in the state. Our cardiac program is in the top 30 in the country. And this again reflects this notion of how we're better together to provide more services in a more convenient fashion to rural Minnesotans. So the drive to improve healthcare is multifactorial again, and you have to pay attention to all of those. I want to spend a minute on mental health issues because that is something that we're all seeing day in and day out. And so we have to have a renewed emphasis on what's a healthy mind-body state. And so we spend a lot of time and resources on reaching out from a mental health perspective. by working with public officials, law enforcement, the judicial system, and anybody that wants to partner to make sure that we're addressing many of these mental health issues, as well as working with all the disparate employers. Minnesota in the rural areas has become quite diverse, and understanding the different healthcare needs of both an aging population and a diverse population is really important to improving the health of our citizens. Um, the other thing I would mention is that socioeconomic issues are very real in rural Minnesota. As I said, we serve roughly 750,000 Minnesotans, and half of the kids that we serve um, qualify for free or reduced lunch. In other words, there's a fair amount of poverty in rural Minnesota. And when you are poor, your access or your ability to access to healthcare is limited. And so, how do we understand our need to provide services to the most vulnerable? Last year, CentraCare committed $310 million to underfunded or non-funded healthcare and public health services. And this is a mission that our board and our team members fully support. The next thing that I would mention is financial challenges. I'm sure you see that there are hospitals across America that close every week. There are hospitals that are closing services because they can't find workers or financial challenges. And I think these financial challenges are real. And again, they stem from some of the demographic issues I mentioned earlier. An aging population and fewer people working that provide a tax revenue to pay for insurance. So what do I mean when I say that? When I went to school when I was a kid in the 60s, there was roughly 5.1 workers for every retired person. Today, there's only about 2.8 to 2.9 workers per retired person, which means that the tax revenue in to help support healthcare um, is is being threatened by an increasing demand as patients age and go on Medicare or Medicaid with a smaller tax base to help pay for those services that they need. And so understanding the financial burden of healthcare in the 21st century is going to be an important conversation for all of us. 70% of our revenue now comes from a government source. That could be Medicare, Medicaid, it could be any one of a number of things. And in general, reimbursement mechanisms from the government, since the government budget is so challenged at the state and federal level, does not pay for the cost of those services. So I suspect that the financial challenges of tomorrow will continue to be very profound for healthcare in America and particularly in rural environments. And that will require a conversation point amongst all of us. The next thing I would cover is Main Street. Um, in all of our communities, and in fact, in most rural communities, the healthcare um, organization is usually the largest employer. It's also a sense of coming together as a community pride, along with the school system and Main Street. And so the recognition that the work that we do is more than just healthcare. It actually involves the sustainability of what we hold precious in America and in Minnesota into the decades to come. So economic development is an important platform for CentraCare. We have invested over $300 million in outstate healthcare in the last 8 years, and we're investing another $300 million over the next 2 to 3 years in a way that helps provide sustainability and excitement to have young kids move back to our communities, to understand that they can have a really great life living in an area where lakes are abundant, fresh air, a sense of community. How do we understand the housing needs as the aging population more and more stays at home? How do we understand the issues around childcare as folks are encouraged to have kids, and what kind of help do they need to take care of their kids while they're working, and how do we make sure that they're getting what they need? How do we reverse the what I call the brain drain, the migration of younger kids as they go off to school and don't come back home? How do we understand that the school participation rate in higher education, and by that I include the trades, um, is an important issue for rural America to encourage folks to have a fulfilled career in anything, whether it's an electrician, a plumber, a farmer, to a physician, is really important part of a shared vision of success for tomorrow. So I think that is another really important issue that we all need to talk about. Healthcare is not just about improving healthcare. It's about making sure that we have a sustainable way of life for the next 110 years. The last thing that I would mention is, and you might think that I'm trying to get on a political high horse, and I am not. These require significant political bipartisanship to address many of these really profound issues. And understanding the root cause of an issue should foster a collaboration amongst all of us, whether it's across businesses, between businesses, and even within the political spectrum. This notion of blaming one side or the other is not very functional. And I firmly believe that we have to accept reality, and we cannot just admire the problem or complain a problem. We must adopt a sense of relentless optimism of doing more together, better, faster. So I would finish right there, Peter, and certainly open it. I covered a lot in about 15 minutes, but I'd look forward to more conversation about what we can do together to help improve the healthcare of our communities and ensure that we have a vibrant future for rural America. Thank you.
Thank you, Dr. Holmen. Do we have any questions? Currently, there are none in the chat or in the question and answer box. So if anybody has any, just feel free to unmute yourself and shout them out. Seeing none, thank you again, Dr. Holmen. We really appreciate your information and what CentraCare is doing to help rural communities. I will now turn it over to Dale Nellor with the National Turkey Federation. Welcome, Dale.
Good afternoon, everybody. Good to see you again, and thanks again for having me join this month for the first educational webinar of the year. It's a balmy 35 degrees here in Washington, D.C., so not quite what I know many of you are experiencing, and I understand it's going to be into the single digits and minus later this week. So I just wanted to provide a quick update on where things stand here in Washington, D.C. As for those of you that were on the last time I was with you folks, we talked a little bit about the outcome of the election and what we were expecting to see over the next couple months. So just going to go through kind of where we stand today and what things look like here for the next few months and into the first 2 quarters of this new Congress. So we are preparing for inauguration week here in Washington. Next week, President-elect Trump will officially take office and start his new administration. So we're in the midst of having streets shut down, things being barricaded as we prepare for all of the activities that will go on here in town next week. As it relates to the transition, not only with the new Congress and the new administration, earlier this month, the 119th Congress was sworn in to office. And so that really started the process of appointing new leadership, where in the House of Representatives, we continue to have Speaker Johnson leading the Republican majority and Jeffries as the minority side on the Senate. We do have a leadership change where John Thune is the new majority leader for the Republican Party. And then as the leadership was set, the process for establishing committees, who the new leadership of the committees were going to be, as well as who the new members of those committees as they filled out the membership. So Committee leadership has been established. I know many of you are aware Minnesota is doing well in the agriculture space, with Senator Klobuchar taking the minority spot in the Senate Ag Committee. And then Angie Craig winning the election to be the ranking member of the House Ag Committee. So strong representation for Minnesota in the Ag Committee in both House and Senate side. The committee membership itself is still being worked out. They have announced some new membership, but as example, for the House Ag Committee on the minority side, they still have 2 slots to fill. They're working through some of their seniority issues and working through the process for where folks are slotted. But we will see a handful of new members in both the House Ag Committee and the Senate Ag Committee, which is something that we fully anticipate and expect. And as we look for the coming weeks, as the committees officially organize, they'll start their hearing process. So speaking of hearings, the new administration has been hard at work having their cabinet nominees up on Capitol Hill the past month, 2 months in some cases, meeting with members, familiarizing themselves, getting prepared for their confirmation hearings. Confirmation hearings started this week. There's been a number held so far, with some today, and then wrapping up into next week. From our perspective, EPA, their confirmation hearing is being held today. Brooke Rollins, who's the nominee for USDA Secretary of Agriculture, she was originally set to have her nomination or confirmation hearing in the Senate Ag Committee this week. Unfortunately, that was postponed due to some of her paperwork not making it through the process in a timely manner. So that's been postponed, but they have rescheduled it officially for next week. So that process has been smooth by all accounts, and we anticipate that her nomination will go through and be approved fairly quickly. From a process perspective, with a lot of these nomination hearings occurring this week, the goal for the new administration will be, once the president is sworn in, the hope will be for Congress to approve as many of the confirmation nominees as possible, so the new president can have as full a cabinet in the early weeks as possible. As we look to first quarter and what we're anticipating in the coming weeks, so with the new administration, everybody kind of looks at the first 100 days. There's been a lot of discussion about executive orders from a variety of issues and topics, everything from immigration to trade. And so that is really something that we're going to be watching closely as the new administration comes in, and what kind of actions and activities do they do, not only in the first 100 days, but just even within the first few days, few weeks of the administration, and what executive orders do they put in place, and what impacts will they have on the ag community. The other area that they'll be looking at, in addition to the executive orders, is regulatory review. That is something that occurs with every change in administration, where all agencies and the White House will go back and review rules and regulations that have been put in place by the previous administration. Usually it's within the first last few months of the administration that are looked at, but they'll take a whole stock look at all the regulatory work of the past administration, and then map out a potential plan for any modifications or changes that they look to do. So those will really be a lot of the activities within the first 100 days for the administration, in addition to finalizing the confirmation of all of the cabinet positions. But then you get into the undersecretaries and the other political appointees within the different departments and agencies that will just continue for the next several months. And that is a process. So while there will be a number of political folks that'll be walking in to USDA as an example next week on Inauguration Day, it will continue to play out over the next several weeks and months to completely fill all the political spots, not only at USDA, but all the other department and agencies across the federal government. So those will be some of the key things that they work on. Additionally, they'll be, and they probably already have been working on it, but the new administration will be looking to make tweaks at their budget proposal for fiscal year 2026. That traditionally comes out, the budget, the first part of February. But when you have a new administration, that typically does get delayed. We haven't heard specifically what the time frame is for the budget to be released, but it likely will not occur the first part of February, maybe closer to the end of the month, or even pushed beyond that. So, but that'll be another item that the new administration will be taking a look at right away as they come into place. As we look from a congressional perspective, there is a laundry list of issues and things that will be on the agenda. And I've highlighted some of them here. Some of them are must-dos. Some of them are priorities of the incoming administration and incoming majority party. But then there's items that just need to be done because they've continued to get pushed. So first and foremost, there's a number of budget appropriation related items that will need to be addressed here in the first two quarters of the year. They did not complete their fiscal 25 appropriation work in December. They passed a continuing resolution that just continues the funding, the current funding level that they had at the time to March 15th. So they will have to decide between now and March 15th, do they do another continuing resolution? Do they do an omnibus package? Or do they try to do a continuing resolution for the remainder of the year and just move on to 2026? So that will be something that has to be figured out here in the very near term. As I mentioned, the 2026 budget will be a little delayed, but that appropriation process will start in earnest in February, especially with the new administration. There'll be hearings where they bring the different agencies up to talk about budget priorities as the appropriations committee in both the House and the Senate starts working through their process to put together their individual appropriation bills for 2026. So there's a lot going on the appropriation side. We also have the Fiscal Responsibility Act. So this was a budget agreement that was reached several years back. One of the triggers that they have in it, that if a continuing resolution or a funding bill isn't passed by April 30th, that they then revert back to some of the budget cuts that were originally proposed a couple years back, and it institutes an across-the-board cut in for defense and non-defense spending. I would fully anticipate that they will address that before that comes, but that again is another date that they're looking at. We have the debt ceiling that Treasury has said needs to be either extended or raised. And then that brings in budget reconciliation. This is a process and a function that can be used by Congress to establish a budget and then mechanisms for the Appropriations Committee to meet those targets. There's been a lot of discussion about how that will play out, if there will be one budget reconciliation package, if there'll be two. I was at an event with one of the leadership in House Ways and Means earlier this week. He thinks that they will likely just go with one reconciliation package, because the reality of it is, if they bifurcate it and turn it into two different packages, it really drags out the process. And the reality is, if they do something early, when will the next one get done? And one of the challenges that Congress is going to have, while Republicans have taken the leadership in the Senate and the White House and have retained control of the House majority is actually 2 seats less than what they had last Congress. So the margins are extremely thin. They have a very small margin of error. And frankly, for most things to pass, they will require Democrat support. And so there's going to be extreme pressure on Republican leadership in the House of Representatives to walk that fine line of pushing forward the president and the Republican Party's agenda, while at the same time potentially bringing proposals forward the Democrats can vote for. Because the unfortunate reality of it is, at this point, there are probably enough Republicans that typically vote no on everything, that puts them in a position where they really need to have Democrat support for many of the initiatives that I have listed here. So again, there's a lot that's on the table regarding the budget, funding mechanisms, etc. And that really kind of sets the table for rest of the year and rest of the things that are talked about, because if they have a budget deal, that will impact their ability to move appropriation bills. It kind of clears the deck. It potentially provides funding sources for the Farm Bill and tax package, trade package. So it's a very fluid situation. It puts a lot of things in play. And so, as you can imagine, their ability to get success in some of these early tasks that they'll be looking to do here in the first few weeks, first few months of this new Congress really will set the tone for rest of the year. Want to just quickly talk about the Farm Bill. As you know, it expired the end of last year. It had to be extended for another year. So the current Farm Bill programs are good until through September. From a House and Senate Ag Committee perspective, the desire is to get a Farm Bill done as soon as possible. That is what they're going to work towards. But I think you can imagine the things that I was just talking through. There's going to be a lot of things that impact the ability of the House and Senate Ag Committee to bring a bill to the floor and ultimately have it passed by the signed by the president. There's a lot of things that are going to have to line up for that to occur. So while we're remaining optimistic about the ability for the new leadership in the House and Senate Ag Committees to work together to come up with a bill that can pass the House floor, can pass the Senate floor, timing of that is really going to kind of be out of their hands. And so while we're optimistic that it gets done as soon as possible, I've also cautioned folks, don't be surprised if we're still talking about trying to do the Farm Bill in July or September. It's an unfortunate reality of DC, but I think it's something that is really realistic. And to that note, I had mentioned earlier, we do have a number of new members in both the House and Senate Ag Committee. In talking to staff, some of the early things that they're going to be planning to do here in the coming weeks and months is do a series of hearings, staff briefings, to really bring their members up to speed on the various issues within the ag community and some of the issues that they've been working on, not only in the Farm Bill, but independent of the Farm Bill. And so we're going to be looking for opportunities to play a role in that and highlight some of the things that we've been working on concerned to the turkey industry as we go through that process. So a lot going on here in Washington. We'll continue to be busy as committees get going, bills get introduced. And so with that, I think I'll just stop there and happy to take any questions folks might have.
Thank you, Dale. Does anyone have any questions for him? Anything they'd like him to address?
I know I covered a lot, so
There's a lot going on in DC now, it sounds like.
there is. But unfortunately, as I like to say, sometimes it's hurry up and wait. So,
Well, it doesn't look like we have any questions coming in. So I will thank you again for your time and for joining us. And I'm going to pass it on to Dr. Shauna Voss. She did ask that I drop this link in the chat. She's going to be addressing some of the new biosecurity audit plans. So there's that link if you'd like to review those. And welcome, Dr. Voss.
Thank you, as always, for having me on the webinar. So just a couple updates today, and I'm going to spend most of my time talking about that audit and the new rule that goes along with that. But a couple quick updates beforehand. This is the exact same slide that I showed at the last webinar, just kind of giving a tally of our total cases over on the right-hand side of the screen for high-path avian influenza. And then our cases that we had during the fall that started in the middle of November and went through kind of the end of the year. So we had, let's see, 5 commercial turkey operations and then 2 backyard flocks, technically 3 with that Martin County divided between 2 prems. And unfortunately, I hoped that we were going to have a break before the spring, but that does not seem to be the case. And so on the first of the year, you guys probably got the suspect disease alert for Olmsted County with a backyard flock that was deemed to be woe and non-poultry, so no control area was established around that farm, and that was confirmed to be high path on January 6th. And then, unfortunately, this week we had a case of commercial turkeys in Dakota County that is at a presumptive positive status right now. I have not received NVSL confirmation, but I expect that may come even yet today. So at this time, we've got 2 control areas that are still in place, our Fillmore County control area and then our Dakota County control area that was established this week. And of course, we are not in this alone. This is the national picture for the last 30 days across the country. We've had 51 commercial flocks, 52 backyard flocks. And you can see by the map that it's definitely our flyway is pretty heavily impacted, but California is still seeing cases. And there have been cases out on the East Coast as well. So we're all kind of in this together still and praying and hoping for that little break. So moving into the interim final rule that was announced by USDA that did become effective on December 31st. I'm trying to move my screen here so I can see some notes that I have. This interim rule does update the indemnity program for high-path avian influenza on poultry farms. So it doesn't address dairy farms, even though we know that they are a big player in this current outbreak this past year. But it provides some conditions to receive indemnity and compensation after testing positive. And since I'll just give you a couple stats as to kind of the drive behind this rule. Since the beginning of the current outbreak that started in 2022, APHIS has made indemnity payments to over 1,200 producers. And of these, 67 unique poultry premises have had at least 2 high-path outbreaks during the current outbreak, and 18 of those have had 3 or more infections. And so that's really the driving factor behind this, is they're trying to eliminate not just infections as a whole, but these repeat offenders. And so with those reinfections, they have paid out over $365 million in indemnity payments, and they're definitely trying to cut that cost. And so the basis behind this rule is that there are now 2 types of audits that will be required to receive indemnity eligibility. And that is first, a restock audit. So this is a farm that has had a detection of high-path avian influenza, must now undergo a biosecurity audit before they will become eligible to restock. And so that's, we haven't done this in Minnesota. This will be kind of that new piece of this audit program, but it is something that we are working on making sure that we can implement. And then the second piece is something that we have already been doing, and that's those buffer zone placements. And so this is required for commercial poultry premises within the buffer zone of the control area. So that's 3 to 7 kilometers away from an infected farm prior to movement of any poultry onto those premises. And so these audits will be required for all detections after December 31st of last year. And so all of the farms that I included on that earlier slide that have had infections in 2024 are exempt from that restock audit requirement. So those farms will continue to move through the process as we have always done. The new piece of this rule and of these audits is that all of these audits must be conducted by an auditor that has been trained by USDA. USDA does have a training scheduled, which I just received notice of today for the first week in February. It is a week-long training course. 5 days, 5 half days will be required. But as you know, we have 2 control areas that are in place right now. And in order to prevent those who are in that control area from being negatively impacted by this, we are currently working with USDA on conditional training for an auditor so that we make sure that those audits can be conducted and those producers can continue to do their business. These audits are, there's 2 possible outcomes, pass or remediation needed. And so that's probably similar to our NPIP audits where we say there's corrective actions needed, but all sections of that audit must have a pass. So every question has to pass in order for them to pass that audit altogether. And if a premises does not pass, the audit can be repeated after those biosecurity deficiencies have been remediated. And I just want to make a note here. One of our auditors who has done these buffer zone placements the last couple of years is going through that conditional training with USDA today to try to get up to speed to be able to conduct that. And I had a note that he sent just right before this meeting. And he said, while the majority of the components of this audit are exactly the same as the previous versions, there are some edits in that the farm is not documenting all of the procedures that are currently in their NPIP plan. They will likely have remediations and not be able to pass that audit. And so with that, I am strongly recommending that every single producer in the state of Minnesota take a look at this audit form and compare it to their current written biosecurity plans and their on-farm procedures to make sure that every item in this new audit tool is being addressed, because I don't want somebody to end up kind of caught off guard if they have to have one of these audits conducted and be working, while we're in the heat of the battle to try to do some of these remediations. And so if I can figure out how to switch screens here, I'm going to stop sharing for 1 second. I'm going to pull up this audit tool. The link is on the slide, and as Peter said, he did send out the link to this in the email right before this webinar. So you can go right to this and find this new buffer zone placement and restocking biosecurity audit tool. This is 17 pages, so I'm not going to go through every question. You can scroll through that yourself. I just want to point out a couple items within here. Scrolling down here, they do have highlighted on this audit form in yellow areas that they believe are currently requirements for the NPIP program standards biosecurity principles. So these are the principles that we have been auditing your written plans against for the last 8 or 9 years. But as you can see, when you go through this, there are a lot of questions that are not highlighted yellow. And so I think you need to make sure that you're looking at every single question, but certainly focusing on these questions that are not yellow, because those are items that we may not have been really reviewing in the same level of detail that they will now be expecting. And so I'm going to scroll down to page 13 here and just point out a couple items. Again, make sure you're reviewing this whole thing and making sure that these items are being addressed on your plan. But a couple things, like question 37 here, it talks about having biosecurity signs at the entrance to your farm. So essentially at the perimeter buffer area. I know some farms have this, but I suspect not every farm in Minnesota already has, signs out there at that driveway at the perimeter buffer area. And so if you don't have that, make sure that you're working on addressing that question. And I'm going to scroll down here to question 45. And it's the same thing they're expecting here. So this is addressing the line of separation. So essentially your barn walls and your entrances into the facility. They want to make sure that they are restricted or monitored during non-business hours. And what they're kind of looking for is if those doors are locked. And I've been on a number of these audits over the last couple of years, and not everybody has locked doors or utilizes those locked doors. So that is something that we need to make sure that we're looking at and able to be able to answer that question with a pass if you end up having to have one of these audits conducted. And the last one that I'm going to point out here is question 49, addresses standing water on the premises that may act as a wild bird attractant. We live in Minnesota. Half of our turkey farms have either a river or a lake that they're named after. It's a problem that we have in Minnesota that potentially could be drawing wild birds to those sites. And we're not going to be able to drain all of these standing waters, but I want to make sure that you guys, if you have some of these facilities either close by or on your premises where there's water that's accumulating, that you've got a way of mitigating or reducing your risk. So if you have to have an audit, you can explain what's being done in order to prevent that contact with wild birds. Okay, and I'm going to go back to my PowerPoint real quick. Potentially. Okay. All right, so I think we're back on the screen again. There's that link for this audit, and we can certainly send it out again if you need access to it. I just wanted to hit real briefly about avian metapneumovirus. I don't need to remind you guys because you are living it, that it continues to be a problem and it continues to circulate in Minnesota with some pretty big impacts. And so I am still hearing reports of flocks that are impacted by this that have a pretty large mortality. And I just want to remind you that, any of these flocks that are exceeding the mortality threshold that's written in your biosecurity plan, or are experiencing mortality rates at, 2 birds per 1,000, we need to rule out high-path avian influenza. So call me, call the board to make sure that we can arrange for that testing. We will cover the cost of avian influenza testing, but we need to be doing our due diligence to make sure that we are ruling that out. And just a quick update on the vaccines, which is I don't have a lot of updates on the vaccines. You probably are aware that there are inactivated or killed vaccines that are available now in the United States. These are less effective at providing a full protection for birds that are impacted by avian metapneumovirus, and the administration method for the killed viruses, which is usually injectable, may prohibit use in a lot of our commercial turkey operations. But there are 4 different companies that offer these vaccines that I'm aware of at this time. And there are a number of breeder flocks in the state that are using these vaccines. The new news, the big news, is that USDA in the middle of December announced that they were going to permit the importation of a modified live vaccine that's produced outside the United States to be able to come into the U.S. for use. And so they, Center for Veterinary Biologics, CVB, did all of the testing that needed to happen in order to allow those to come in. And so that product was tested for safety. It was not necessarily monitored for effectiveness. At this point in time, I don't have any additional information on availability and use. So each state by state, does have to approve the use in Minnesota. We are planning on ensuring that vaccine is available to use in Minnesota upon request. We're just kind of waiting for those next steps. So hopefully by the next webinar, we'll have some additional information on them. And then lastly, I just want to remind you, as usual, about the testing schedule for the Minnesota Poultry Testing Lab and the VDL. And just to remind you that for avian influenza samples, all of those samples must be received by the MPTL by 11 a.m. Monday through Friday in order to have that same day testing. So if they come in even at 11:05, you will have missed the cutoff unless you have made arrangements for us for sick bird testing, in which case we can make exceptions to have those flocks tested at a later time. Both labs are closed on Monday, the January 20th, which is a state and federal holiday. The MPTL will be closed. The VDL has reduced services only, but they do have on-call staff available for emergency sick bird testing. So if you need your flocks tested due to mortality, due to clinical signs, give me a call and we will make arrangements to make sure that we can get that to happen. And again, for any weekend or holiday emergency testing, our goal is going to be to shoot for testing at noon. And if we are unable to meet that, or those samples can't get to the lab until late in the afternoon, we'll be looking at testing the following day. Again, my phone number, which is a cell phone number, is on the screen. Give me a call to make those arrangements. And that is what I have for an update. I'm happy to take questions.
All right. Thank you, Dr. Boss. Do we have any questions for her? I am seeing none. So thank you again for joining us today. And I think we'll conclude just a little bit early today. We got about 8 minutes left of our hour-long webinar, and we'll just jump off a little early. Thank you again to everyone who attended. And as a reminder, this will be posted on the members only section of our MTGA website. Thank you and have a good day.